Up until recently, the most conventional way of handling the insomnia was pharmacologic. And there are a variety of pharmacologic agents which are much safer and much more effective than the old agents, the barbiturates and the bromides and the placidils of the 1950s, 60s, and 70s. But even with these agents, we find that a large number of these people eventually become accommodated to them. In other words, the agents stop working. They don't get addicted to the agents, that's the mistake, but it just no longer works. So more and more what we've been doing with our insomnia patients is been going ahead and using what we call cognitive behavioral therapy, or you'll often see it abbreviated as CPT. In cognitive behavioral therapy, we actually can train people to rethink the way they're approaching their insomnia. I can tell you one of the most classical mistakes that people make when they have insomnia. They get into bed way too early, thinking that by getting into bed early, they'll give themselves more chance to fall asleep. And it's been shown that the longer you stay in bed awake, the worse your insomnia would get. So it's better to restrict it, and one of the more challenging and interesting new therapies is called sleep restriction. By restricting the amount of time in bed, you actually can improve somebody's sleep.